Selamat datang di Kampus Politeknik Kesehatan Kemenkes Malang, Polkesma. Perguruan Tinggi Kesehatan di bawah naungan Kementerian Kesehatan Republik Indonesia. Kampus utama Polkesma berlokasi di Jalan Besar Ijen Malang. Kampus yang berdiri mulai tahun 2001 ini merupakan salah satu dari 38 institusi pendidikan kesehatan yang dimiliki Kementerian Kesehatan. Dalam perjalanannya, Polkesma memiliki visi menjadi politeknik kesehatan yang beradab dan berdaya saing global, serta terdapat sejumlah misi yang diemban, antara lain menyelenggarakan pendidikan dan pembelajaran yang berkualitas untuk mengembangkan potensi dan kepribadian mahasiswa yang beradab dan berdaya saing global. Kemudian menyelenggarakan penelitian terapan dan pengabdian kepada masyarakat yang berkualitas dan inovatif. Selain itu, melaksanakan tata kelola organisasi yang baik berbasis teknologi informasi. Dan yang terakhir, mengembangkan kerjasama kemitraan dalam negeri maupun luar negeri. Polkesma memiliki 5.000 mahasiswa. Kampus yang menjadi barometer pendidikan kesehatan di Indonesia ini membawai 7 kampus yang tersebar di Malang, Jember, Blitar, Kediri, Trenggalek, Ponorogo, dan Lawang. Dari semua kampus tersebut terdapat 20 program studi. Polkesma telah berhasil meraih akreditasi baik dan termasuk dalam kualifikasi 1 Politeknik Kesehatan di Indonesia. Pencapaian tersebut merupakan gambaran penerapan sistem manajemen mutu tata kelola institusi dan strategi pembelajaran inovatif, serta pemanfaatan teknologi informasi yang terus berkembang.
Salam sehat, sehat tanpa korupsi. Saya, Budi Susatya, Direktur Poltekkes Kemenkes Malang. Tahun 2021, Poltekkes Kemenkes Malang menjadi salah satu Satker UPT Kemenkes yang diusulkan menjadi Satker wilayah bebas dari korupsi tingkat nasional. Zona integritas dibangun dalam upaya mewujudkan tata kelola perguruan tinggi yang baik dan bersih menuju wilayah bebas dari korupsi dan wilayah birokrasi bersih melayani. Dengan semangat yang tinggi, Poltekkes Kemenkes Malang berkomitmen menuju wilayah bebas dari korupsi tingkat nasional untuk mewujudkan perguruan tinggi yang bersih, melayani, profesional, efektif dan efisien, dengan harapan agar seluruh layanan di Poltekkes Kemenkes Malang menjadi layanan yang semakin bermutu dan berkualitas, terwujud budaya integritas.
Komitmen bersama dilaksanakan untuk menuju zona integritas wilayah bebas dari korupsi yang dicanangkan Kementerian Pendayagunaan Aparatur Negara dan Reformasi Birokrasi. Fakta integritas menjadi pegangan untuk berbenah. Perubahan positif berkelanjutan terus dilakukan di seluruh tingkat manajemen, perbaikan fasilitas maupun sistem pembelajaran. Untuk memacu kinerja pegawai, sistem reward and punishment diberlakukan. Menuju pelayanan prima, Polkesma terus memperbaiki sistem layanan, baik konvensional maupun sistem digital berbasis teknologi informasi. Ruang layanan akademik menjadi sentra pelayanan terhadap mahasiswa maupun alumni. Sikap ramah, santun, dan solutif menjadi budaya oleh setiap pegawai Polkesma dalam memberikan pelayanan. Untuk mendukung peningkatan kualitas pelayanan, disiapkan perangkat digital yang mengatur antrian. Tak hanya itu, untuk mengawasi pelayanan agar berjalan semestinya dan menghindarkan dari praktek korupsi, kolusi, dan nepotisme, Satgas Pengawasan Internal selalu siap memantau di semua sektor pelayanan. Untuk memberi kemudahan terhadap mahasiswa, serta mengurangi interaksi antara mahasiswa dan pegawai yang berpotensi menimbulkan praktek kecurangan, manajemen membuat sejumlah aplikasi digital termasuk dalam hal pembayaran. Masing-masing mahasiswa diberikan akun virtual untuk menyelesaikan segala tanggungannya.
Oleh pihak kampus kita sangat dimudahkan untuk pengurusan administrasi tersebut, dan salah satunya juga adalah pembayaran SPP. Untuk pembayaran SPP
ini merupakan salah satu dari 38 institusi pendidikan kesehatan yang dimiliki Kementerian Kesehatan. Dalam perjalanannya, Polkesma memiliki visi menjadi politeknik kesehatan yang beradab dan berdaya saing global, serta terdapat sejumlah misi yang diemban, antara lain menyelenggarakan pendidikan dan pembelajaran yang berkualitas untuk mengembangkan potensi dan kepribadian mahasiswa yang beradab dan berdaya saing global. Kemudian menyelenggarakan penelitian terapan dan pengabdian kepada masyarakat yang berkualitas dan inovatif. Selain itu, melaksanakan tata kelola organisasi yang baik berbasis teknologi informasi. Dan yang terakhir, mengembangkan kerjasama kemitraan dalam negeri maupun luar negeri. Polkesma memiliki 5.000 mahasiswa. Kampus yang menjadi barometer pendidikan kesehatan di Indonesia ini membawai 7 kampus yang tersebar di Malang, Jember, Blitar, Kediri, Trenggalek, Ponorogo, dan Lawang. Dari semua kampus tersebut terdapat 20 program studi. Polkesma telah berhasil meraih akreditasi baik dan termasuk dalam kualifikasi 1 Politeknik Kesehatan di Indonesia. Pencapaian tersebut merupakan gambaran penerapan sistem manajemen mutu tata kelola institusi dan strategi pembelajaran inovatif, serta pemanfaatan teknologi informasi yang terus berkembang.
Salam sehat, sehat tanpa korupsi. Saya, Budi Susatya, Direktur Poltekkes Kemenkes Malang. Tahun 2021, Poltekkes Kemenkes Malang menjadi salah satu Satker UPD Kemenkes yang diusulkan menjadi Satker wilayah bebas dari korupsi tingkat nasional. Zona integritas dibangun dalam upaya mewujudkan tata kelola perguruan tinggi yang baik dan bersih menuju wilayah bebas dari korupsi dan wilayah birokrasi bersih melayani. Dengan semangat yang tinggi, Poltekkes Kemenkes Malang berkomitmen menuju wilayah bebas dari korupsi tingkat nasional untuk mewujudkan perguruan tinggi yang bersih, melayani, profesional, efektif dan efisien, dengan harapan agar seluruh layanan di Poltekkes Kemenkes Malang menjadi layanan yang semakin bermutu dan berkualitas, terwujud budaya integritas.
Komitmen bersama dilaksanakan untuk menuju zona integritas wilayah bebas dari korupsi yang dicanangkan Kementerian Pendayagunaan Aparatur Negara dan Reformasi Birokrasi. Fakta integritas menjadi pegangan untuk berbenah. Perubahan positif berkelanjutan terus dilakukan di seluruh tingkat manajemen, perbaikan fasilitas maupun sistem pembelajaran. Untuk memacu kinerja pegawai, sistem reward and punishment diberlakukan. Menuju pelayanan prima, Polkesma terus memperbaiki sistem layanan, baik konvensional maupun sistem digital berbasis teknologi informasi. Ruang layanan akademik menjadi sentra pelayanan terhadap mahasiswa maupun alumni. Sikap ramah, santun, dan solutif menjadi budaya oleh setiap pegawai Polkesma dalam memberikan pelayanan. Untuk mendukung peningkatan kualitas pelayanan, disiapkan perangkat digital yang mengatur antrian. Tak hanya itu, untuk mengawasi pelayanan agar berjalan semestinya dan menghindarkan dari praktek korupsi, kolusi, dan nepotisme, Satgas Pengawasan Internal selalu siap memantau di semua sektor pelayanan. Untuk memberi kemudahan terhadap mahasiswa, serta mengurangi interaksi antara mahasiswa dan pegawai yang berpotensi menimbulkan praktek kecurangan, manajemen membuat sejumlah aplikasi digital termasuk dalam hal pembayaran. Masing-masing mahasiswa diberikan akun virtual untuk menyelesaikan segala tanggungannya.
Oleh pihak kampus, kita sangat dimudahkan untuk pengurusan administrasi tersebut, dan salah satunya juga adalah pembayaran SPP. Untuk membayar SPP, kita bisa melalui virtual account jika kita memiliki, dan mungkin salah satunya juga kita bisa melalui ATM, langsung ke ATM seperti itu. Jadi tidak perlu datang jauh-jauh ke kampus.
Dalam bidang pelayanan administrasi, Polkesma juga telah menerapkan sistem digital. Sistem ini berlaku untuk pegawai internal maupun terhadap mahasiswa atau alumni dan masyarakat luas. Diwadahi dalam website poltekesmalang.ac.id, segala alur layanan administrasi dapat diakses, seperti legalisir online, pengajuan SK online, hingga pengaduan gratifikasi secara online. Peningkatan fasilitas guna memberikan rasa nyaman terhadap mahasiswa terus dilakukan, mulai ruang belajar dengan fasilitas terstandar, sarana praktikum, laboratorium, perpustakaan terpadu, pos layanan kesehatan, layanan konseling, tempat ibadah, asrama, fasilitas olahraga, gazebo, kantin, ATM, ruang laktasi, ambulans, panggung orasi, hingga secure parking. Guna mendukung referensi pembelajaran terhadap mahasiswa, Polkesma memiliki ruang perpustakaan yang cukup lengkap. Ruangan ini juga dilengkapi perangkat digital guna memudahkan mahasiswa dalam melakukan pendaftaran maupun pencarian buku. Di bidang pembelajaran, Polkesma telah menerapkan strategi pembelajaran yang efektif dan menarik. Didukung dengan kurikulum pendidikan tinggi, vokasi Polkesma menerapkan kurikulum dual system, di mana sejumlah 70% kegiatan praktikum, praktik klinik dan magang, dan 30% pembelajaran teori. Implementasi pembelajaran inovatif dengan konsep blended learning yang menyenangkan dan memudahkan. Tak hanya itu, penerapan konsep internet-based test dalam ujian dan pembelajaran juga dilakukan dengan konsep e-learning.
Kami sebagai mahasiswa enjoy dengan sistem pembelajaran yang ada di kampus kami. Jadi kami lebih bisa mengaplikasikan teori yang diberikan oleh dosen kami, dan kami dapat memahaminya secara lebih cepat.
Polkesma memiliki 220 tenaga pengajar dengan kualifikasi magister dan doktoral dari berbagai disiplin ilmu yang akan membentuk skill profesional dan karakter bagi para mahasiswa. Polkesma telah terbukti melahirkan lulusan yang bekerja di institusi kesehatan di dalam negeri, bahkan luar negeri. Dari semua perubahan yang telah dilakukan mendapat respon positif dari mahasiswa maupun masyarakat luas. Hal ini bisa diukur dari indeks kepuasan masyarakat yang menunjukkan masuk kategori baik. Di masa pandemi COVID-19, Polkesma Malang juga turut berkontribusi mengkampanyekan protokol kesehatan bagi pengajar, mahasiswa, maupun masyarakat umum. Untuk memberikan perlindungan terhadap pegawai maupun mahasiswa, Pemberlakuan memakai masker, mengukur suhu, serta mencuci tangan menjadi hal wajib dilakukan saat memasuki area kampus. Selain itu, selama pandemi, kegiatan perkuliahan dilakukan secara daring. Polkesma juga menjadi garda terdepan bagi pemerintah untuk membentuk herd immunity pelaksanaan vaksinasi. Lebih dari 10.000 dosis vaksin dilakukan di kampus oleh tenaga kesehatan dari Polkesma. Dari peningkatan kinerja dan perubahan positif yang dilakukan oleh manajemen, telah mengantarkan Polkesma meraih predikat wilayah bebas dari korupsi atau WBK di lingkungan Kementerian Kesehatan RI. Peningkatan pelayanan serta beragam inovasi yang telah diciptakan akan bermuara pada pelayanan prima yang berujung kecepatan, kemudahan, dan kenyamanan bagi masyarakat umum, mahasiswa, maupun internal pegawai.
Before the event starts, permission to confirm the rule for participant international guest lecture. 1. For students of Bachelor of Applied Nursing in Malang and profession of nurse, they are required to use a username in the order level underscore student number underscore name. Example, 3B underscore 25 underscore Nabila. 2. Camera or video must be active during activity. 3. Microphone must be turned off during activity. And the last, participants are expected to press speaker view menu, which is in the upper right corner of the screen. To all participants of the guest lecture 2021 to fill in the link attached, which is open when the event starts until the event ends. The link present will be listed in the Zoom chat room and can be accessed via a browser by copying link listed in the chat room. Assalamualaikum warahmatullahi wabarakatuh. Shalom, Om Swastiastu, Namo Buddhaya, salam kebajikan dan salam sejahtera bagi kita semua. The Honorable Chairman Bachelor of Applied Studies Program Nursing in Malang, Ms. Dr. Erlina Suci Astuti, SKPNUS MKOP. We respect Head of Nursing Profession Studies Program Malang, Mr. Joko Wiono, SKP MKOP SPCOM. We respect Presenter Guest Lecture 2021, Ms. Esther Sheila Mary George AMNS. We respect the lecturer and guests of the Guest Lecture 2021. Let us express our gratitude to the Son of God Almighty, who has bestowed His grace and guidance, so that we can attend the International Guest Lecture 2021, Friday, 3 December 2021, with the theme, Trend and Issue Perioperative Nursing in Philippines in a Healthy and Happy State. Introduce me, Servin Anggraini, as the host for today. The order of event on this day is as follows. 1. Opening. 2. Prayer. 3. Singing the National Anthem Indonesia Raya and Hymn Health Polytechnic Minus Timawan. 4. Speech. 5. Submission of material and continue with a question and answer session. 6. Photo session together. And the last, closing. That's composition today. Even to start today's event, let us pray according to our respective religions and beliefs. First will be led Islamically by Bisma. To Bisma, time is yours. Permisi untuk doa, suaranya tidak terdengar.
Selamat datang di Kampus Politeknik Kesehatan Kemenkes Malang, Polkesma. Perguruan Tinggi Kesehatan di bawah naungan Kementerian Kesehatan Republik Indonesia. Kampus utama Polkesma berlokasi di Jalan Besar Ijen Malang. Kampus yang berdiri mulai tahun 2001 ini merupakan salah satu dari 38 institusi pendidikan kesehatan yang dimiliki Kementerian Kesehatan. Dalam perjalanannya, Polkesma memiliki visi menjadi politeknik kesehatan yang beradab dan berdaya saing global, serta terdapat sejumlah misi yang diemban, antara lain menyelenggarakan pendidikan dan pembelajaran yang berkualitas untuk mengembangkan potensi dan kepribadian mahasiswa yang beradab dan berdaya saing global. Kemudian menyelenggarakan penelitian terapan dan pengabdian kepada masyarakat yang berkualitas dan inovatif. Selain itu, melaksanakan tata kelola organisasi yang baik berbasis teknologi informasi. Dan yang terakhir, mengembangkan kerjasama kemitraan dalam negeri maupun luar negeri. Polkesma memiliki 5.000 mahasiswa. Kampus yang menjadi barometer pendidikan kesehatan di Indonesia ini membawai 7 kampus yang tersebar di Malang, Jember, Blitar,
Even to start today's event, let us pray according to our respective religions and beliefs. Prayers will be led Islamically by Bisma. To Bisma, time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Marilah sejenak kita bersama-sama menundukkan kepala, bermunajat kepada Tuhan, agar kegiatan kita hari ini diberkahi dan bisa berjalan dengan lancar. Doa akan dipimpin secara Islami, bagi yang beragama lain dimohon menyesuaikan. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Wassalatu wassalamu ala asrofil anbiya'i wal mursalin. Sayyidina wa habibina wa safina wa maulana Muhammadin wa ala alihi wa sahbihi ajmain. Ya Allah, Tuhan yang Maha Esa, dengan segala kerendahan hati, kami yang berkumpul di tempat ini mempersembahkan puji, syukur kehadirat-Mu atas nikmat dan rahmat yang telah Engkau anugerahkan kepada kami. Ya Allah, yang Maha Pengasih lagi Maha Penyayang, atas segala rahmat dan karunia-Mu, pada hari ini kami hendak menyelenggarakan acara kegiatan pelaksanaan International Guest Lecture Politeknik Kesehatan Kemenkes Malang. Berkatilah kami, berilah bimbingan kepada kami untuk dapat melaksanakan kegiatan dengan ikhlas, baik dan benar sesuai jalan yang Engkau ridhoi. Dan jadikanlah itu semua nilai ibadah dan nilai ilmu yang bermanfaat bagi kami. Ya Allah, ya Wahid, Engkau yang Maha Satu dan Maha Mempersatukan. Kami mohon, jadikanlah acara ini sebagai momentum untuk dapat merekatkan rasa persatuan dan kesatuan di antara kami. Jauhkanlah kami dari perpecahan dan permusuhan. Jadikanlah tekad kami sebagai pemuda pelopor untuk membangun negeri dan bermanfaat untuk agama, negara, dan bangsa. Ya Allah, Tuhan yang Maha Pengampun, ampunilah semua dosa kami, dosa-dosa ibu bapak kami, guru kami, dan para pemimpin kami. Terimalah amal perjuangan kami, serta tempatkanlah kami dan mereka semua dalam lindungan, rahmat, dan ampunan-Mu. Ya Allah yang Mujib, Engkau yang Maha mengabulkan doa. Perkenankanlah doa kami dan permohonan kami. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzabannar. Subhana rabbika rabbil izzati amma yasifun. Wassalamun ala mursalin. Walhamdulillahirabbil alamin. Amin amin ya rabbal alamin. Wassalamualaikum warahmatullahi wabarakatuh.
I remind all participants of the guest lecture 2021 to fill in the link attached, which is open when this event starts until the event ends. The next event was singing the national anthem Indonesia Raya and the Heart Polytechnic hymn of the Ministry of Heart of Malang. First sing the song Indonesia Raya. Next is the hymn of the Health Polytechnic of the Ministry Malang. The next agenda is the speech of the head of the Malang Applied Nursing Undergraduate Study Malang. To Ms. Dr. Erlina Suci Astuti as Kepnes MKep, time is yours.
Thank you, Ms. Sherin. Assalamualaikum warahmatullahi wabarakatuh. Salam, Om Swastiastu, Namo Buddhaya. Greeting and peace all of us. Good morning. The Honorable, our guest lecturer, Mrs. Esther Sheila Mary Garros, Magister Nursing Science from SPUP. Hello, ma'am. Hello, ma'am Sheila. Okay, the Honorable Head of Nursing Department, Health Polytechnic of Malang, Mr. Imam Subekti SKEP MKEP SPCOM, the Honorable of Head of Nursing Profession Education Program of Health Polytechnic Malang, Mr. Joko Wiono SKP MKEP SPCOM, and all lecturers and our students. First of all, I would like to greet and thanks Mr. Sheila from Mrs. Sheila from SPUP, our guest lecturer from SPUP, who will be delivering lecture about trend and issue of perioperative nursing in Philippines. This topic is the same as our vision and mission of Applied Science and Nursing of Health Polytechnic of Malang. Ladies and gentlemen, as I heard from Mr. Kisa, our speaker today, Mrs. Sheila, before being a lecturer in the SPUP, she was a practitioner who worked in the perioperative room from a long time. In this lecture, I wish we can get a valuable knowledge about perioperative nurse work in Philippines. The most about how much case of perioperative is there, the role of nurse, and last available technology in perioperative nursing in Philippines. We hope this lecture would help participants expand their horizon facing trend and issue in perioperative nursing and continuing a good international relationship, collaboration, and partnership between Health Polytechnic of Malang and SPUP. And finally, I wish you all inspiring and insightful lecture. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you to Ms. Dr. Erlina Suci Astuti as Kepnes MKEP. I remind all participants of the International Guest Lecture 2021 to fill in the link attached, which is open when the event starts until the event ends. The next agenda is the presentation of the materials. Material will be delivered by Ms. Esther Sheila Mary PMNS and will be guided by Mr. Arif Bahtiar as Kepnes MKEP PhD as moderator. Previously, permission to read CV from Mr. Arif Bahtiar. The name is Mr. Arif Bahtiar. He was born in Malang, 28 July 1974. Now he lives in Perumpuri Losari Asri, Block M3 Singosari, and now he works as lecturer of nursing department at Poltekkes Malang, start from 1995 until now. And his education is postgraduate of nursing. And now to Mr. Arif Bahtiar, time is yours.
Terima kasih, Mbak Sefin. Cek 1, 2. Suara saya bisa diterima? Bagus ya, Mbak?
Ya, bisa, Bapak.
Oke. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Good morning and a very warm welcome to everybody once again. It is my privilege to introduce our guest speaker of this morning. We have invited a distinguished speaker from St. Paul University to talk about trend and current issues in perioperative nursing. To all audience, let's give a round big applause to Mrs. Esther Sheila Mary Garros, Master of Science in Nursing. Okay, let's say hello to Ma'am Sheila. Magandang umaga, Ma'am Sheila. Kumusta ka po? Halo, Ma'am
Hi,
Sheila.
good morning, everybody.
Good morning po, Ma'am.
Selamat pagi. Yes,
Magandang
selamat
umaga.
pagi semuanya.
Thank you,
Selamat
Ma'am.
Guys, can
pagi,
you hear me
Mrs. Sheila.
already? Can you hear me?
Yes, ma'am. Your
Mhm.
voice very clear.
Selamat
Right, ma'am?
pagi. Yes, semuanya. I hope I'm saying it right. I hope I'm saying it right in Indonesia.
Yes, ma'am.
So,
That's right.
good morning, everyone, most especially to the administrators. Sir Imam, of course, I remember these names, no, because they were very warm when we were there, everybody. Sir Imam, Sir Joko, Sir Arif, of course,
Yes.
Ma'am Shervin, I hope I'm pronouncing the name right.
Shervin,
Ma'am
yes,
Eka,
Shervin.
my friend, I know she's there because she messaged me actually yesterday.
Oh,
yes.
yes.
And she said, Ma'am Sheila, I'm excited to see you tomorrow, because she
Oh,
even
yes.
sent the poster ahead of Sir Kisa. So
Oh,
yes, and of course, Sir Kisa, we miss you here in St. Paul University already, because I used to just see you around here, but then because of the pandemic, I don't see you anymore. No,
All right, ma'am.
it's always a pleasure to be with all of you, of course. And thank you, Sir Kisa, for the invitation, because I'm not supposed to be your speaker. When he messaged me, he said, "Ma'am, do you know somebody from St. Paul Hospital operating room? Because we need a speaker to speak to us about the trends and issues." But then the OR nurses there are so busy. You know, COVID has brought a lot of problems, most especially to the nurses of all over the world, no, most especially to the operating room nurses. So okay, sige, I'll be the one to lecture for you, I said. So I already prepared my slides ahead of time. Okay, so thank you, Sir Kiza, but don't worry. I'm prepared for this lecture because I've been in the OR for 15 years already. I can discuss to you anything about operating room. Okay, so can I already share my slide with everyone?
Wait a minute,
so I
ma'am.
can start
Wait a
my
minute, ma'am.
lecture.
Sheila, wait a minute.
Yes.
We will go
Yes,
back to you
sir.
later after
Yes,
completely
sir.
read your CV. Yes, wait a minute, because the time not now. I will come back to
Okay.
you.
Okay.
I will come to you after completely read your CV. Wait a minute.
Okay.
All right.
Okay. I'm sorry. I'm sorry.
Yes, yes,
Okay.
ma'am. Okay, ma'am. It doesn't matter. Okay, Ma'am
Okay.
Sheila.
Okay.
Yes, Ma'am Sheila worked in government from June 1994.
Okay. Thank you
till
very
2000.
much.
Yes, you're welcome. Ma'am Sheila worked in the government from 1994 till 2004. After that, she worked as staff nurse at Clinica de Lion, 2004 until 2006. Now she is a clinical instructor at St. Paul University since 2006. As clinical instructor, her activities following up students in the operating room, delivery room, medical surgical unit, intensive care unit in several hospitals, such as St. Paul Hospital, Cagayan Valley Medical Center, and Norte de Chartres Hospital in Baguio City. She also was a member at the graduate school, St. Paul University, Philippines, from 2011 to present. Lastly, she is a member of Operating Room Nurses Association of the Philippines. Now we will go back to the Ma'am Sheila. Are you ready, Ma'am? Sorry. All right, Ma'am. You have 1 hour for presentation. So now it's 9:17, and hopefully the presentation will end.
Yes, I'm sorry. I'm sorry. Yes.
Yes, at 10:17. Okay, ma'am, please enjoy your time.
Okay.
Time is yours, ma'am.
Okay. Thank you very much. So I'll be sharing my slide with you already. I hope you can see my slide.
Okay, ma'am.
Okay, so I'll be talking to you about the trends and issues. Yes, I'll be talking to you about the trends and issues in perioperative nursing, not only in the Philippines, but particularly in the hospitals here in Cagayan, because I'm sure that some of you would also be coming here later for your exposure once we resume the face-to-face classes, no? Your students have not been, if I remember it right, your students have not been exposed yet to the operating room of St. Paul Hospital, no? What I remember is that when I handled them, they were exposed at the emergency room and the ICU. But then anyway, I would like to start discussing about some new exciting procedures that are already done here in the hospitals in Cagayan, which I know your students will be looking forward to handle also in the future. Okay. So let me start with the catheterization laboratory of St. Paul Hospital, no? You know, the cath lab is not yet done. So it's about to open in January. And it will be the first hospital here in Cagayan to have a catheterization laboratory, no? It will open, like I said, in January, and it's really something to look forward to, because the procedures that are done here are really procedures that are only done in Manila and in other countries. So we are excited because we do not have to bring some of our patients anymore here in Cagayan to Manila. So we just have to bring them also to the St. Paul Hospital. So what are the procedures that are done here in the cath lab? We do percutaneous transluminal catheter angioplasty. I hope that our audience students will already know what the percutaneous transluminal catheter angioplasty is all about, no? We also do cardiac catheterization here. We do atherectomy, and we do percutaneous coronary interventions, no? But I remember it right, though Cagayan is a little laid back, no? Back in 2008, when I had my duty in Baguio, they already perform all these procedures there because they already had their catheterization laboratory back in 2007. But then again, one thing that's sad is that the students are not allowed to assist in these procedures because they are highly invasive procedures. So every time that there are catheterizations that are done, no, the students do not have their duty there. They are brought to the ward. Okay, so they are not even allowed to watch because they close the cath lab, and just the staff nurses of Notre Dame are the ones who get inside. Okay, so the procedures that are done actually in Baguio, they also even do heart surgeries already there, no? Your coronary artery bypass graft, they already do that there. So I don't know, we are also looking forward that maybe in the near future we can also have all those procedures here in Cagayan already. Okay, so that's it, the catheterization laboratory. It's actually a separate building. They are putting up a new small building just for the catheterization laboratory. I'm sure that you already have this there. Do you already have this there, Sir Kisa? Because I know that you are far advanced when it comes to facilities there in Malang. I don't remember it when we went there. I don't remember if there's a cath lab in your private hospital, because I think we went to 2 big hospitals there, and probably you already have this a long time ago. Because like I said, you are far advanced when it comes to facilities and when it comes to technology. I know this is not something new to you already. Okay, so the next procedures that are already done here in St. Paul Hospital, most especially in the Cagayan Valley Medical Center, is the laparoscopic cholecystectomy. I know that your students are familiar with this, and I'm also sure that you already have this there in Malang a long time ago. But I just would like to share it with you because before, our patients with who undergo cholecystectomy, laparoscopic cholecystectomy, are brought to Baguio and are brought to Manila just for this procedure. Okay, as we can see it here in your picture, okay, the laparoscopic cholecystectomy is this one. No, we don't make big incisions, while in the open cholecystectomy, we make mga 5 to 7 inches of incision. Okay, and of course, we encourage the patients to undergo laparoscopic cholecystectomy because the healing process is shorter. Though it's more expensive, no, and usually it only takes 30 minutes to 1 hour for the procedure to be performed. While in open cholecystectomy, of course, the procedure is longer, and the patient, it takes 2 weeks to 1 month for the patient to get well. Okay, so our students have been assisting in laparoscopic cholecystectomy, as you can see here in the picture. Okay, there is a screen there. You know, the first time the students assisted in lap chole, we call that lap chole here, no? They were really so excited because, you know, they assist and they give the instrument, they scrub and all, and they think that, you know, it's something new to them. So they even, if you make them choose between assisting a laparoscopic cholecystectomy or open cholecystectomy, they would be more excited to assist in the laparoscopic cholecystectomy. Okay, so we already have that here in St. Paul University, St. Paul Hospital, and in Cagayan Valley Medical Center. Okay, so we also have our laparoscopic gynecologic surgery already here, no? Where they perform self-injectomy, they perform hysterectomy, and they also perform oophorectomy already, no? So I think this was just last year because before the pandemic, no, I have not seen anybody performing this procedure yet. But when I called Sir Mark at St. Paul Hospital, he said that, "Ma'am, we already have laparoscopic gynecologic surgery here in the St. Paul Hospital, and we are also excited to be with your students again, so they can also see how the laparoscopic gynecologic surgery is performed." Okay, so just like your cholecystectomy, no, we also make use of 4 small incisions. And then, of course, the patient's recovery period is also shorter than with the open gynecologic surgeries. Okay, so we don't have to bring anymore our patients to Baguio or to Manila. And of course, just like the laparoscopic cholecystectomy, the cost is also a little more expensive. Okay, so the next one we have would be neurosurgeries, no? Actually, neurosurgery has been performed, I think, 5 years or more ago in St. Paul Hospital, no? What brain surgeries are performed there? We do craniotomy, or we do borehole. We also do craniectomy. We also do clipping of aneurysm. We also do some spinal surgeries, no? But you know, spinal surgeries, they perform that in 8 to 12 hours, so it's really too long. That's why the students sometimes do not like to scrub, because the 8 hours is already already done, and the procedure is not yet over. So they would not like to scrub in the spinal surgeries. No, we also do spinal decompressions, and we do final fusions, no? And we also do some laminectomy, okay? One thing good about neurosurgery is that the doctors who perform these surgeries in St. Paul Hospital and Cagayan Valley Medical Centers are very good doctors. They are very good to the students. Sometimes even if the students are afraid to scrub, they call for the students like, oh, you come here, you come and scrub with us so that you will learn, you will see how the brain looks like, you will see how the spine looks like, and that you will also have something to relate to your classmates later on, no? So these are exciting cases for our students to assist, no? And we also look forward that later on your students will also have to be exposed here in the operating room and be able to assist all these surgical procedures. Okay, so one thing that is also new in St. Paul Hospital would be the corneal transplant. I know that probably there in Indonesia, you have been having this a long time ago, no? But like I said earlier, St. Paul, Cagayan Valley is a little laid back. So we just had corneal transplant last June, if I'm not mistaken, because that's what Sir Mark told me. No, usually the kind of operations that they perform there would be before they only do ECCE. No, I know that their students already know what ECCE is. No, with the posterior chamber intraocular implants. That's what they do there. But right now, they already perform your corneal transplant. But all the other procedures, ECCE, our opta doctors already have their own clinics. They also perform ECCE already in their own clinics. No, okay, so that's also one thing that is making us very excited. But you know, the students do not scrub the eye operations because the instruments are different, the sutures are different, the instruments are very small, and the sutures are very small. So they only make use of one microscope. No, it's only the surgeon who is making use of the microscope. So the students cannot see the sutures. So it's so difficult for them to assist. Okay, and there's a special nurse who would assist, no, a nurse who underwent training to assist the eye operations. Okay, so the one thing that I'd like to talk about also is that the protocols and guidelines and recommendations, no, during the COVID-19 pandemic, because I know that it has made everything very difficult for everyone, no, especially for the operating room nurses, because before, when we assist in the OR, we only put on our scrub suit, and then we scrub, and then we put on the sterile gowns, no. But now you have to have 3 layers of suits, no. You still have to put on your PPE, and then you still have to put on your gown with all the masks and with all the face shields and goggles and everything. So it's really so difficult for everyone, no. So I would like to share with you the guidelines in the operating room for during the COVID-19 pandemic, no. When there's a positive patients or a positive or probable patients, no, when they are highly contagious, they make use of the level 3 PPE. So probably you are thinking, what is the level 3 PPE? I will be showing it to you later. It is consists of a sterile gown, and also the gloves over the PPE, and then they perform hand hygiene also after putting on their PPEs, no. And then when there is a surgical procedure or of COVID-19 positive patients, no, or probable or suspect patients, when they are considered highly contagious, we also make use of the level 4 PPE, no, which is consist of the sterile gown, the sterile gloves over the coveralls, and then we also make use of the PAPR, no, if it is available. And then of course we also perform hand hygiene, but usually we don't hand wash anymore, no, because we hand wash before we put on the PPE, and then after putting on the PPE, we do disinfection, making use of 70% alcohol. Okay, so we don't do this before during the before the pandemic. Okay, So what is the level 1 PPE? What is the level 2? What is the level 3? What is the level 4? So here they are. Your level 1 would only be making use of your surgical mask. And they are used, this level 1 PPE is only used for low risk areas, no, like the offices, the HRs, the billing sections, and the cashiers. Okay, when there is no possible exposure to COVID-19 patients, no? And then we also have our level 2 PPE, which is consists of your goggles or your face shields and the surgical mask. And these are used to staff who are in the dietary, the linen, the ABG, the ECG stations, no? So pharmacy, top laboratory, and security guards, no? So they make use of the level 2 PPE. Okay, so in our level 3 PPEs, this is actually consist of your N95 mask. Make use of the goggles. Of course, you have your gown and then your gloves, and you make use of the shoe covers. These are used by the nurses who are in COVID areas, most especially if they stay with the patients for less than 4 hours, and during physical assessments and brief interactions also, no? And if they do the swabbing and they observe the patient for clearance, and they do the doffing. So all of these things, you make use of the level 3 PPEs. And of course, your level 4 PPEs, which is consist of your goggles and your face shield. Also, you make use of the N95 mask. You have your coveralls, you have your gloves and your shoe covers. So these level 4 PPEs are used by nurses or staffs who are exposed to COVID, who are in the COVID areas for more than 4 hours. They also make use of this during the intubations, during CPRs, during OR procedures, no? And our nurses in the hospital make use of this actually. So I know it's just the same. You also may let your nurses use this level 4 PPEs there, no? We have to be extra cautious. We have to be extra careful, because if we get infected, and so we infect all the other nurses and all the other staff also in the hospital. And not only that, we also bring the infection in our homes. So we have to be extra cautious. Okay, so it's also important. I know you know this already because you are level 4s. I know you have already assisted in your surgical procedures in the hospital. Here in the Philippines, when it's a minor procedure, we only do medical hand washing for 20 to 30 seconds, no? But right now that there is COVID, we don't do medical hand washing, but every time, if we do medical hand washing, we do it consistently and persistently, no? So it really is a must that you have to be free from infection. Okay, so of course, you also know already your surgical hand washing. I'm sure you already know the steps, because we follow the same procedure in all the hospitals, right? And of course, you also know that surgical hand washing is done for 2 to 6 minutes. Okay, so I will not be discussing further when it comes to hand washing, because I know you are already familiar with that, no? So we move on to the other issues here in the Philippines, no? We have RA 7170, which is the Organ Donation Act of 1991. So actually before, organ donation is a taboo in the Philippines, no? But back in 1991 with RA 7170, which is an act authorizing the legacy or the donation of all or part of a human body after death for specified purposes, no? It has become legal in the Philippines as long as the donors and recipients are blood relatives. So if they are related, then there will be no problem, no? But if it's without an emotional bond or any organ, transplant is illegal among non-relatives. Because under the new legislation, no, each individual can donate all or any part of his or her body by a way of a legacy or a will, no. In the Philippines, organ and tissue donations from donors who have been declared brain dead has been allowed, no. Although human transplantable organs include, as you can see in the pictures, they include the kidneys, the liver, the lungs, no, the heart, the intestines can already also be donated, no, the pancreas, in addition to all the human tissues such as the eye tissues, particularly the corneas and the sclera, the bones and the skin and blood vessels can also already be donated, no. But of course, there's an ethical issue because the DOH or the Department of Health here in the Philippines also discourages the incentivized organ donations, no, where living organ donors, when they are not related to the recipients, are motivated by financial rewards. In short, no, they buy the organs, no, and this system creates a risk for both the donor and the recipient, exposing them to further injury. Okay, so not only that, but in this way, also the organ trafficking is also prevented, which is already very rampant, not only in the Philippines, but also in other countries, okay? This is actually one of the ethical considerations of the organ donation, that some people are already making money out of it. Okay, so there is another issue, of course, which is the government hospitals versus the private hospitals, no? As you can see in the picture, I don't know if it's the same there, no? But I think your some of the government, I'm not saying all, no, but to some other government hospitals here, no, when it's a private hospital, they are the rooms are clean, no, they follow all the protocols and everything, no, because the patients in the private hospitals are those who can afford to pay their bills, even if the bills are big, even if the bills are huge, they can pay. While in the government hospitals, the patients that are coming or going to the government hospitals are those patients who cannot afford, actually, no. They are the poorest of the poor, because here we have charity wards, no, wherein if the patients are brought there, they do not even pay a single centavo. It's the government that pays for them. Okay, but the issue here would be, they say that in the government hospital, the quality of care is not really very good, because the nurse-patient ratio, sometimes if there's one nurse, the nurse handles 10 to 15 patients. Okay, so the quality of care is not very good as compared to the private hospitals, wherein the patient ratio sometimes is one nurse is to, at the most, 5 patients. So the quality of care is better. Okay, I don't know if it's the same there. Okay, so there's another issue also here. I don't know if it's true also there with you, no, that the doctors in the government, as you can see here in my picture, no, the doctors in the government hospital are, they are always angry. I don't know why. And the doctors in the private hospitals are, they are always smiling. Probably there are some reasons why. Maybe one, because in the government hospitals, as I've mentioned earlier, the doctors are paid by the government. No, they get their salaries from the government, so they are paid. They do not get enough pay, or they do not get enough salary. Wherein the doctors in the private clinics, no, every single patient that go to them or that goes to them, they are paid. So they are paid more. So in the government, in the private clinics or in the private hospitals. And also the reason why the doctors also are very sensitive in the government hospitals is that they handle more than 100 patients a day, no? And the doctors in private clinics, no, if they only have a quota, sometimes 20 patients, that's already enough. Okay. And also not only the doctors, but the private nurses, the nurses also, no, in the private hospitals are also very poised because their rooms are air conditioned and they only handle a few patients, no, just like the doctors, no. But in government hospitals, you can see, oh, they are always angry. They are always scolding the patients because the patients there are very unruly. The patients do not even follow instructions. The patients do not even follow protocols. Why? Because of course the patients here are those who cannot afford to pay their hospital bills, no. And the patients who go to the private hospitals, like I said earlier, are the patients who are very willing to pay more. Okay, but here in the Philippines, the private nurses are paid less actually. And the government nurses are paid more, which is different from yours. Because I think what I heard before, and I was there, the nurses in the private hospitals are paid more. And the nurses in the government hospitals are paid less. Okay, so those would be some of the issues. And of course, there's more, no? Probably later on when I still have time, I would like to show you also how the preparation for the patient for surgical procedures are done here during the COVID-19 pandemic, no? If we still have time, because their preparation is different from when COVID is not yet COVID is not yet here, no. So I'd like to move forward, of course, to the perioperative practices here in the Philippines. Of course, we have the phases of the perioperative care, which I know you are already very familiar with. Because I don't know if we follow the same procedures or we follow the same phases, no? So your nursing responsibilities during the preoperative phase would be most important of all, as you can see in the picture, would be the signing of the consent. Okay, so here in the Philippines, the one who explains the procedure to the patient would be the surgeon. Okay, so once the consent is brought to the patient's room, the surgeon explains all the procedures. He lets the patient sign the consent, and then the nurse would only serve as the witness. So the nurse also signs in the consent as a witness. Okay, so what else are the things that are done during the preoperative period? Of course, health teachings are done because all these things are done before the procedure, because if you do this after the procedure, once the patient is already in pain, no, your patient will not be able to understand you anymore. So what are the preoperative teachings? You instruct them how to do deep breathing. You instruct them how to turn from side to sides, that they have to do it earlier in order to prevent complications. You explain to them the pain medications that they have to take. You explain to them the equipments that they have to use, like, for example, the incentive spirometer. What's the use of that? How to use it? You have to emphasize also the nothing per orem policy, and you tell them the reason why you have to do this. No, you are not supposed to take anything, water, including food, including medicines. No, so all of those are not given to you in order for you to in order to prevent aspiration during the procedure. Okay, and you also have to do leg exercises after. So all of those things are explained to them before the procedure. So what else are done? You have to assist them from head to toe. You have to get their weight. You have to interview them, no? You have to check their background, the psychological needs, what were the medications that were given to you. The laboratories that are done are these, no? Why do you have to have laboratory procedures? No, here in the Philippines, we call that your cardiopulmonary clearance, because just in case there are some laboratory examinations that are not normal, we have first to correct all of those, no? Before we proceed to the procedure. Okay, because just in case something happens to the patient, no, the doctors and the nurses are not held liable. Okay, so you also have to give them also, you also have to check the medications, like for example, anticoagulants must have to be stopped usually 1 week before the procedure, no, so that to prevent bleeding. No, other medications that are given to them would be given 1 hour before the procedure. So what are these medications? We give them sedatives. No, we sedate them before they are brought to the OR. Okay, of course, to prevent anxiety. Okay, we also give them antibiotics as prophylaxis, and we also give them some pain medications as prophylaxis. So those things are done perioperatively. Okay, so I have already discussed to you, the preoperative checklist, which are checked or which are done a day before the surgery. So you have to check if the teachings are completed, consent forms are signed, the patient is on NPO, the patient has allergy bands, no? The patient must not have to bring all those jewelries in the operating room because they might get lost. Or if the patient still has a jewelry on during the procedure, if they make use of the cautery machine, no, the patient would have will be grounded. Okay, so you will also have to let your patient void before the transfer or before the procedure, or if not, an indwelling Foley catheter is placed, no. Check also for the pre-op meds if they are all given. Of course, you have to put the side rails up before and after the procedure so that to prevent your patient from falling. You also have to remove the contact lens, the dentures, and everything, no? So why do you have to remove the dentures? Because your patients might swallow them, most especially if they will be intubated during the procedure. Okay, so you also have to check the nail polish. You'd better tell your patients that when they come to the hospital for surgical procedure, remove all those nail polishes. Okay, because it's where they check if there's the patient's circulation and perfusion are still normal. Okay, so vital signs are also checked every 4 hours or every 30 minutes, 1 hour before the procedure. They also have to make sure that pre-op lab works are on the chart. All the abnormal lab values are already corrected because of there are some abnormal laboratory examinations, then they do not proceed with the operation. Okay, skin preps are done. You also inform your patient to take a bath, to shave before going to the OR. And like I have mentioned earlier, better check also if these medications are taken or are not taken. No, the aspirin, antidepressants, steroids, and non-steroidal anti-inflammatory drugs. Okay, so let's go also to your pre-anesthesia checkup. Usually, the anesthesiologist goes to the patient a day before the surgery. No, she also has to do thorough assessment, just like what the nurse and the surgeon did. No, so the patient undergoes very thorough assessment, not only once or twice, but many times. Okay, so the anesthesiologist would ask the patient, what are the medications that you've been taking? Have you had a history of surgery? So what anesthesia was given to you? So just in case the patient does not remember, they will do some skin testings of all the medications that will be given to them during the operation to prevent any further problems during the operation. Okay. So when everything is already explained to the patient, no, and then the anesthesiologist would ask the patient, did you understand all the instructions that were given to you? So if you understand them, can you tell me what were those instructions? So if the patient is able to say all the explanations of the anesthesiologist, then it means to say that he or she understood all the instructions. Okay, so in the intraoperative, I know it's also the same as yours, but like I said earlier, it's a lot different now that COVID is here. No, so when we transfer the patient, we do that very carefully and very cautiously. No, since the patient is already was given sedative already, sometimes the patient are already asleep when they are brought to the OR. Or if not, if they are still awake, then probably the ones who would transport the patient to the OR would have to talk to the patient, ask some questions, no, and also raise the side rails. And then, of course, as you can see, no, they are all in masks already. They are in their caps already, and they are already in their scrub suits. Okay, so the OR nurses are the ones who go and fetch the patient to their rooms, and they are the ones who transport them going to the OR. Okay, so as you can see here in the intraoperative, no, anesthesiologist is the one who gives or who inducts the anesthesia. Okay,
Yeah.
and yes. Okay, the anesthesiologist is the one who inducts the anesthesia, and not only that, the anesthesiologist is assisted by the circulating nurse, of course, because both of them are unsterile. No, the part of the OR team or the members of the OR team that are unsterile would be the circulating nurse and the anesthesiologist. Okay, and both of them are the ones who monitor the vital signs of the patient. The circulating nurse is the one who makes or who does the charting, I should say, and the anesthesiologist is the one who tells the nurse that these are the medications that are given. Please assist me. If the anesthesiologist cannot give all those medications, it's the circulating nurse who gives the other medications. Okay, so there are some patients also who are intubated, and sometimes there are also patients who are not intubated. So it depends upon the case. Okay, so there you can see the surgeon already performing the hand washing, but usually it's the scrub nurse who scrubs ahead. Okay, because the scrub nurse is the one who offers the gown to the surgeon. I don't know if you do the same thing there. Sometimes the doctors put on their own surgical gowns, but most of the time, the scrub nurse, when he or she is done scrubbing and putting all the gown and the gloves, no, she or he offers the surgical gown to the surgeon, and he or she also offers, including the gloves and everything. Okay. So there, as you can see, the nurse is already done scrubbing. The circulating nurse is the one tying the gown, and another circulating nurse is offering the gloves. Okay. So this would also be one of the nursing responsibilities of the nurses. No, they do instrument counts before they do it. Also another counting before closing time. They have to check if the instruments are complete, including needles, sutures, sponges, and everything that they use, no? Because just in case something is missing, then probably it's left there, you know, inside the patient's abdomen, and if it's not removed, that would of course cause infection. No, that is a foreign body. It would cause infection. And if something happens to the patient, if the instrument is not removed and the patient has an infection afterwards, who will be held liable, it would be the nurse and the doctor. They are the ones. Actually, we have many cases like those, no? The patient's relatives sue the doctors and the nurses, no? Because they have left something inside, no? They did not perform their responsibility of counting the instrument before closing. Okay, so this is actually a picture, no? While the operation is going on. Okay, so we already go to the post-operative phases. Here we have three post-operative phases. The first one would be the immediate post-anesthetic phase. No, this is the phase wherein the surgical procedure is done. And then the patient is already brought to the recovery room or the post-anesthesia care unit for vital signs monitoring. Usually, if the patient is already stable after 2 hours, no, the patient is already brought back to his or to her room. Or if not, in St. Paul Hospital, we have this surgical intensive care unit, no, where we place our patients from the recovery room, most especially if they are high-risk patients. Like, what are these high-risk patients that are brought to the to the surgical intensive care unit? The post-craniectomy patients. Okay, because they really need monitoring not only 2 hours after the procedure, but 24 to 48 hours after the procedures. Okay. So, but before we bring your patient back to the ward, no, we of course check. We also check the Aldrich scale. No, as you can see, I know you also use the same thing there. No, the score should be 9 or 10 before they are brought to the ward or to their respective rooms. As you can see, the complete score for respiration should be 2. No, if your patient is able to take deep breaths and cough, no, so the score is 2. Okay, so the auto saturation, the score is 2 if it's 92 or above. And if your patient is fully awake already or is already conscious, the score is 2. And of course, circulation, if it's already okay, the score is 2. And if your patient is already able to move 4 extremities, which means to say that the anesthesia is already starting to wane, no? So the patient can already move both hands and both feet, no? So the score is 2. So like I said earlier, the score should be 9 or 10 before the patient is brought to the ward or brought to his or her room. But if the score is 8, so the patient stays at the PACU unless and until it. Okay, so of course, when your patient is already in his or her room and is already able to converse with you, able to ask many questions already responsive, already able to do all your deep breathing exercises, moving, ambulating, no, coughing, splinting, and everything, no. If they are able to do all of those already, they are already in your intermediate post-operative period. Okay, so we teach them how to make use of the incentive spirometer. Of course, that is part of your pre-operative nursing responsibility, like I have mentioned earlier. So what else are done? They do diaphragmatic breathing. Okay, they also do splinting, like I said earlier, and coughing. They do turning. Okay, they do early ambulation. You have to explain all of these to them because there are some patients who are not cooperative. And if they say it's so painful and I do not like to ambulate, I do not like to move, I do not like to cough because it's making the incision more painful. So you have to explain to them that if you don't do all these things, the more you will feel pain, no? the pain will be longer. And you also have to explain to them that your recovery period will be shorter if you do all these things, because you do all these things to prevent complication. Okay, so you also do some leg exercise to prevent deep vein thrombosis and to promote circulation. Okay, so the aim of your phases 1 and 2 would be homeostasis. When you say homeostasis, it's your patient be able to adjust already for the procedure. And another one would be to treat the pain or to control the pain or the pain management, making use of all the deep breathing and turning and everything. Okay, so those would be some of the techniques to treat the pain or to prevent pain. Okay, and also you have to prevent and detect early complications of the surgery. Okay, so what would have to be some of the most common complications of surgery? The intestinal adhesions, most especially to abdominal surgeries. No, if your patient do not ambulate immediately or do not from side to side immediately, because your intestinal adhesion, this is actually one of the 4 mechanical obstructions. No, so if there would be adhesion, your patient will have to undergo another operation. So you have to explain that to your patient. Okay, so another one would be the benefit of your turning and ambulating would also have to be preventing pneumonia, because all of those things promote circulation. Okay, promote circulation and promote pneumonia, most especially your coughing and your deep breathing techniques. No, they prevent pneumonia and atelectasis. Okay, so we move on to the next. Of course, we teach your patient also how to care of their wounds. Okay, that's also one importance of your splinting when you cough. No, also you instruct your patient or your significant others or the relatives of your patient to keep the dressing clean and dry to prevent infection, and also report if there are drainage and bloods and pus and green drainage or reddish drainage, or if there is pain in the incision site. So you always have to remind your patient that if he or she experiences or be able to see drainage in the wound, no, he has to report that immediately to the nurse or to the physician. Okay. Okay, so these are some of the other complications. You have your dehiscence and of course your evisceration. No? So dehiscence would be the wound is opening, right? And then evisceration when there is a protruding organ already in the opening. So these are actually complications of surgery. Okay, so we also teach them how to care of their, not only their wounds, but to care of their drains. We actually have types of drains in the Philippines. I don't know there in Indonesia, because like I said, you are far advanced there. Here in the Philippines, these are the kinds of drains that we have, most especially in Tuguegarao or in Cagayan Valley Medical Center and in St. Paul Hospital. No, we have the Jackson Pratt, this one, which is like a grenade, okay? And then we have the Hemovac. And then, of course, we have the Penrose drain, okay? If there are big wounds, no, we make use of the Jackson Pratt and the Hemovac. But if the wounds are just small incisions, no, 1 inch to 2 inches incisions, no, we make use of the Penrose drain. And your Penrose drains, your Penrose drain also comes in different sizes, okay? So there, your third phase would be the convalescent period, or the after discharge phase already, wherein your patient is already on his way to full recovery. This is your time when your patient is already at home and already going up for coming back to the hospital or coming to the doctor for follow-up checkup. Okay, so that would be your convalescent period. We already expect your patient to be up and about, no? Already having full diet, already able to resume activities, can already perform activities of daily living and everything, no? So your patient is already in your convalescent stage or convalescent phase. Okay, so I don't know if I still have to discuss this with you, but in the Philippines, there are actually classifications of surgery. Okay, so the classifications are surgery according to purpose. You have your diagnostic procedure or diagnostic surgery, which is a removal and the study of tissue to make a diagnosis. Examples of this surgery would be biopsy. Okay, so you get a tissue and then submit it for diagnostic purposes, no, like biopsy. Okay, so that would be a good example of your diagnostic surgery. And then you have another one. You have your exploratory surgery, which are more extensive surgery, and it involves exploration of a body cavity, making use of scopes inserted through a small incision to determine the extent of a disease condition. Like, for example, would be the exploratory laparoscopic surgeries, no? Your lap cole, your lap gynae. So those are examples of your exploratory procedures or exploratory surgeries. And then you also have your curative surgery, which is the removal or replacement of defective tissue to restore a function. Example of that would be arthroplasty. Okay, arthroplasty or removing the defective joint because of arthritis. No, so to treat the condition. So that would be one good example of your curative surgery. Okay, so we also have your palliative surgery, which is a procedure that is done to relieve the symptoms or enhancement of function without a cure. Like, for example, thyroidectomy. Okay, that is one good example. What else? You have appendectomy, hysterectomy. So those are examples of palliative procedures. Okay, and also we have cosmetic surgery is another surgery which is according to purpose. We have cosmetic surgery is correction of defects, no, or the improvement of appearance or change in physical features. You know, in Baguio, this is one exciting procedure which my students look forward to, no, because in Baguio, back in 2007 or 2008, they already perform cosmetic surgeries there. Like we assisted in operations like facelifting, no, nose lifting. We also do liposuction there. No, the students are very excited when there's liposuction. No, oh my God, this is how they do liposuction. I don't know if they do. Your culture there in Indonesia, you also do liposuctions there. No, but of course, sometimes we are of different religions. No, so we also have to respect the cultures of the individuals. So there are some procedures that they do not adhere to. Like, for example, there is a religion here in the Philippines, which is, I don't remember, I think the Sabbathist or the Jehovah's Witnesses, no, they do not adhere to blood transfusion. That's why if there are some patients who come to the hospital that they need blood transfusion, no, if they say no because we are Jehovah's, no, the nurses must have to their strong convincing power to be able to convince the patient to have blood transfusion. So you must have to explain to them that it's already a matter of life and death, that if you do not do blood transfusion to the patient, no, your patient might die. No, so that would be one characteristic of a nurse, no? You must have to have a strong convincing power. Okay? So we also have another category of surgery according to urgency. We have emergency surgery. These are your surgeries which should be done without delay. You have to do them now. You have to do them at once because this procedure, they are done immediately to sustain life or to maintain function, no? And the patient requires immediate attention because the condition is already life-threatening. For example, would be vehicular accidents, no? Or repair of or clipping of aneurysm. So those are examples of your emergency operations. Okay, so we move on to the next urgent surgery. This actually is a procedure that is done. It should be done within 24 to 48 hours as compared to your emergency surgery. No, your emergency surgery should be done immediately. But your urgent surgery, it must be done for the next 24 to 48 hours. Like for example, kidney stones, no? So you can delay them actually, no? Other procedures like appendectomy, if they are not ruptured, they are considered urgent surgeries. Okay? So the next one would be the required surgery, which is another type of surgery according to urgency, which is warranted for conditions necessitating interventions within a few weeks. So the difference among the three would be emergency, do it at once, urgent surgery, do it 24 to 48 hours, and then required surgery, you must have to perform them in the next weeks or in the next month. Okay, so example would be your cataract surgeries. Okay. Next one would have to be elective surgery. So these surgeries are actually scheduled, no? And the clients may not or may submit. They have the option actually to undergo or to not undergo surgery. Okay, like for example, removal of cysts, no? Repair of scars. Okay, vaginal repairs, because they are done here in the Philippines, no? You know, during this time of pandemic, in most of the hospitals, most especially St. Paul hospitals, if there are positive patients who are for surgery, they do not schedule elective surgeries. Only that patient who is COVID patient, who the only surgery that is done would be the surgery of the COVID patient. Okay, because they have to prepare, you know, they have to prepare a few days before the surgery. Everything, the instruments, the staff must have to be very prepared. The anesthesiologists must have to be prepared. No, the surgeons and all the other staff inside the operating room, no? All of those, they must have to be very ready. But they said they do not perform surgeries when the patient is COVID if it's an elective procedure. They only perform surgeries for COVID patients if it's an emergency surgery. Okay, so it's really so difficult here in the Philippines. And I know it's also difficult there, no? So we have to make a lot of adjustments. Okay, and then the last one would be another surgery according to urgency. We have optional surgery, which is, of course, the patient must have to make a decision if she's going to have the surgery or not. The examples would be cosmetic surgeries, no? So whether the surgery is performed or whether the surgery is not performed, no, it will not make a difference to the patient. So it's an optional surgery. Okay, so moving forward. Okay, so we also have some surgeries, types of pathologic processes requiring surgery. You have your obstruction, no? What is your obstruction? It's actually an impairment to the flow of vital fluids, examples of which are you have your blood, your urine, you have your cerebrospinal fluid, and you have your bile. No, examples of this surgery, example of cases would be hydrocephalus, no, cholelithiasis, no, intussusceptions. So these are all obstructions which require surgery. And then another one would be perforation. Your perforation are actually your rupture of an organ. Example would be your ruptured appendix, okay, or your ruptured aneurysm. And then another one would have to be erosion. Erosion is the wearing off of a surface of a membrane, example of which is burns. That is the best example for your erosion. Okay, and then we have another one. We have tumors. These are your abnormal growths. Okay, example of tumors would be you have your brain tumors, you have your myomas, no, and you have your cysts. So those are all examples of your tumors. Okay, so moving forward, we have surgeries according to degree of risk. No, we only have two actually. You have your major surgery, and you have your minor surgery. So you have your major surgery. These surgeries are actually high risk, and they have a greater risk for infection, because they are more extensive surgeries, they are longer surgeries, and there is a large amount of blood loss, which is amounting to more than 500 ml of blood loss. Okay, so the other one would have to be the minor surgeries. These surgeries are generally not prolonged. No, actually, we also call them your day surgeries or your outpatient surgeries. No, because they do not lead to serious complications. The risk is also lesser, and the amount of blood loss is less than 500 ml. Okay, these are the surgeries wherein if they are done, the patient can already go home. That's why we also call it your day surgery. Okay, so here in the Philippines, I don't know if it's the same with you. Here are the members of your perioperative team. Okay, so you have I think I have another picture here, this one. So you have your surgeon. I know, I hope you can see my cursor, no? You have your main surgeon, and there is this is the another assist surgeon, and then you have the scrub nurse, and then you have the circulating nurse, and then of course you have your anesthesiologist, no, the one who gives the anesthesia or who intubates the patient. So there are 5 members of the OR team here in the Philippines. The ones who are sterile would be the surgeon and the circulating nurse. And the ones who are unsterile would be the scrub nurse, I should say, is the one that is sterile. And the ones who are unsterile would be the circulating nurse and the anesthesiologist. Okay, so like I said in my CV, I said that I am a member of the Operating Room Nurses Association of the Philippines. This is actually an organization of the OR nurses, wherein we also have our annual convention every July, but I think we had the last convention in July 2020, but it's a virtual, it's done virtually, because of COVID. And then we also had other activities, not only conventions, but we also do some bloodletting. We also do poster making contests, video making contests, and we also do outreach activities, like for example, if there are typhoons, these operating room nurses go out of their way and give relief goods to typhoon victims, just like last year. Okay, when Typhoon Ulysses hit the Philippines, they had all the members. I don't know how many members do we have, but considering the many hospitals here in the Philippines, we have more than 100,000 of operating room nurses who are members of the ORNAP, and we help each other put put up some amount and buy goods and distribute them to the typhoon victims. No, so here are, of course, we also have the Perioperative Nurses Association of the Philippines Cagayan chapter, which is, of course, the officers are my colleagues. No, as you can see, there's a picture here. They are these nurses who are in red. No, they are the officers of the Perioperative Nurses of the Philippines Cagayan chapter, and they were my companions in Cagayan Valley Medical Center. Some, of course, some officers are, of course, also members of the staff of the St. Paul Hospital, and some of them also were my students. No, they also have activities like tree planting. No, as you can see, I have a poster here. No, they actually had the second virtual Perioperative Nurses Week, which was held last November 12 and 14. No, so they also had some discussions. No, there, as you can see. No, we earn CPD units also from the lectures. No, and then they also had some activities like what I mentioned earlier. We had some quiz bee there. Oh. They had video making, poster making, no, and they also had. We also celebrated the Holy Mass. They also had some virtual concerts, and they also award outstanding operating room nurses in Cagayan Valley. So these are some of our activities. And this December, we will have the annual convention of the Cagayan Valley chapter, which will be held, I think, if they will not change the schedule, I think we usually have it on December 19 or 20. And then the national convention will be, hopefully it will not be held virtually already, as we already move forward to 2022. All the nurses are already vaccinated and have already received their boosters. No, so probably we can already have the conventions face-to-face also later. Okay, so thank you very much. Like I said earlier, if we still have time, I would like to show you a video. Sir Kisa, do we still have time? I would like to, yes, I would like to show you a video of how we prepare our patients here during the COVID-19 pandemic, which is actually a video which I got from the YouTube. No, I'll just check if it's here. No, I'll just have to share it with. Wait a minute. I think I'm sharing my
Maybe you only have 10 minutes left, ma'am.
Okay, it's okay. So I think the video is just 10 minutes, no? So
okay, ma'am.
Okay, I'm actually looking for the video, but if I cannot look for it anymore, then probably wait. I'll check if it's in my email. I hope my internet connection will be working, so I can open the video. I think this is the one, no? Okay, so. Can you hear it, Sir Kiza? Can you hear it, Sir Kiza?
Yes, ma'am.
Okay.
Sir Arif as moderator, ma'am. I cannot hear the sound, ma'am.
You cannot hear the sound, Sir Kiza?
Yes, yes, ma'am. Oh, I cannot hear. I cannot hear the sound.
They can hear it? The sound is okay? Okay. I'll have to share it again. I'll have to share it again. I'm sorry. I'll have to share it again.
Yes, sir, I do.
I think it's a nice video, no? But I'll check if how can I share it, no? Okay, I'll check how I can share it. Probably, I don't know how. Oh my God. Choose virtual. I don't know how can I show. Probably I'm 20. I'm sorry, no, because I'm 20 years behind when it comes to technology. I don't know how I can be able to share this video, no. But anyway, I will just have to wait. Okay. I'm sorry. I think like I said, I'm 20 years behind when it comes to technology. So probably I can just send the link to everyone so that you can watch it probably later on, no? Because that's how we how we prepare the patient for operation, no? From the time that the patient comes from the ward to the time that the patient is brought to the operating room, and from the time that the patient is intubated. It's all there in that video. It's actually so beautiful. I just I just found it yesterday in the YouTube, and that's the closest that I can share with you of how they prepare the patient here in the Philippines during the COVID-19 pandemic. Okay, thank you very much for the opportunity to be having the lecture with all of you. No, I hope that I was able to share. It's just a brief lecture. It's just a brief discussion. What I actually know, actually I cut my lecture short because what I thought is that I'll be speaking with you. I'll be doing the lecture for 2 hours, no? But like you said, while it's 1 hour, oh my God, I think probably I will extend my time later, and Sir Kisa might be angry with me because he told me it's only 1 hour, and I might be wasting too much of your time. Okay, so thank you very much, everybody, for this opportunity, and I hope that very soon we can all see you all here in the Philippines again, and be with your students. Are our students already graduating? These fourth-year students, are they having their duty already in the operating room? Sir Kisa?
All right, ma'am. Ma'am, we have still 20 minutes for question and answer session.
Okay, it's okay.
Yes.
Yes. Okay.
And from your presentation, I think actually we have the similar concern, ma'am. Especially in Malang, we have laparoscopic surgery, especially in abdominal surgery. We do transplantation. We also we also find the gap between government and private hospital. In terms of attitude, we can find also the family we're waiting the patients in any part in the hospital.
Yes.
I think yes, we have almost similar concern here.
Yes, and of course, when I was there, you know, I was awed with your hospitals because it's very organized, and you know, like I said, no, you have your facilities are far advanced comparing it in the hospitals here in Cagayan, no. But in Manila, of course, the facilities are far advanced also. We are just a little laid back here in Cagayan. That's why I'm excited also to share all of this with you, because I know that your patient will be coming here again later. And then, of course, probably you can also expose them in the operating room, no? Because we also have a very big operating room, a very big OR complex, actually, because in the OR complex, you also find the delivery room where they do nursing normal spontaneous delivery, and where they also perform cesarean section. Okay, yes. I know these things are no longer new to you, but it's new to the students here in Tuguegarao, because they do not have to go to Manila anymore to be able to assist all these procedures, the laparoscopic, gynae, and the lap colon and everything. No, actually, before we have shortage of doctors, no? That's why probably all these procedures are only now. But now that we have medical schools already, like St. Paul University already has a school of for the physicians, no, college for College of Medicine, no, and we also have CS Cagayan State University already, which also offers the College of Medicine. So we have already a lot of doctors which are produced here in the universities in Cagayan. And they go for training abroad, they go for training in Manila, and when they come back, they are already fully equipped with all the knowledge and the experience. That's why we already have all these things here in Tugigaraw. We are very, very lucky. And also, I would like also to inform you that we already have SM, there's another SM mall here, which will open soon, a bigger mall than the SM mall that we have right now. And when you come here, I know that your students will love to go to SM, to a bigger SM already, which is near St. Paul University. It will just be a tricycle away from St. Paul University. So those are the things that really makes us very excited. And one thing more, we are also very excited that when we have face-to-face classes already, probably we can visit Malang again because, you know, you are all very warm there. I would like also to meet again all those friends whom I met when we were there with Ma'am Lilian, no? And all the students who have been accompanying us to go around, to visit the places, the beautiful places there in Malang, and you know, go and have your duty again there in your beautiful hospitals. And one thing that also owed me would be your simulation room. It's really your facilities there are very good. So looking forward to visit your university again and your hospitals there in Malang.
Maybe next month
Thank
we'll
you.
visit there, ma'am.
Yes.
Next year. Yes.
Yes, when COVID is when we have controlled COVID already, but we have another variant, so I don't know what will happen to us. Hopefully, that will not be able to enter Philippines or enter Indonesia, no? So that we can move around very freely already later.
Ma'am, so far we have two questions in the checkbox. The first is about the effect of conflict on nurse performance at government hospital and also in the private hospital. Yes, ma'am.
So
how the effect of conflicts on nurse performance, ma'am?
I think the biggest problem there would be the quality of care that they give to the patients. No, in private hospitals, like I said earlier, they handle fewer patients than in the government hospitals because the nurse patient ratio in private hospitals would be at the most they handle 5, 6, or 7. So that's the most. Okay, probably it's because the ones who go to the private hospitals, the patients who go there are those patients who are really very willing to pay big amounts for their hospitalization. No? Unlike, of course, in the government hospitals, we cater to charity patients, no? The patients who are the poorest of the poor, who cannot even provide for their hospitalizations, no? Because the government is the one who pays for their hospitalization. So, I've had my duty there in the surgery ward. Before I followed up students in the operating room. I had my duty at the surgery ward, and my God, I had my duty on a Sunday. We were 3 nurses, and the number of patients was too big. They were 70, and we were only 3. So, you really cannot give quality care to, one nurse would handle 20 patients or more. I think the quality of care is really compromised. So probably that's the biggest difference between the government hospital and the private hospital.
Okay, ma'am. Thank you, ma'am.
That's probably okay. Yes, ma'am. Okay. Probably also that's why the salary of the nurses in the government hospital is bigger because they handle more patients. Yes.
Oh yes. Yes. Thank you, ma'am. The second one is about the pain, ma'am. Pain is the most problem that will be suffered by post-op patient. Would you like to share what kind of nursing activities that are usually performed in the Philippines? Pain management, ma'am. And how the nurses perform the procedures and how the effect of patient response after the pain intervention by nurse.
What come again, sir? The pain?
Yes, pain. Pain is
What?
the most
Pain,
problem.
yeah.
Pain.
Pain.
Yes.
Okay. So here in the Philippines, what we usually do is that, of course, we do thorough assessment. No, pain is a subjective. Pain is very subjective. So if the patient says it's painful, if the patient says it's painful, no, it's actually, you don't know if it's true or not. But of course, we have the scoring for the pain. No, we have the we, in a scale of 1 to 10, we ask them. 10 is the most painful. 5 is not really very painful, and 0 there's no pain at all. So if it's 0 to 5, we do the independent nursing actions only for those. No, we do, like, for example, let them do deep breathing. Okay, you divert their attention so that they will not be complaining of pain. So those are the things that we do for mild to moderate pain. We only give them pain medications when the pain is already severe. Like, for example, if it's 7 to 10, that's the only time that we give them pain medications. When our students make their nursing care plans, which I know you also let your students do, no? We actually always tell them that in your NCP, do not always prioritize, when your problem is pain, do not always prioritize your intervention that you have to give the medication, the pain medication. No, you first have to know of the level of pain of your patient. If it's 5 or 6 or something, the pain is still tolerable, you have to maximize first all nursing interventions. No medical intervention yet. Nursing interventions. Okay, but if the pain is not tolerable anymore, if it's 8 to 10, it's severe pain already, that's the only time that you give pain medication. Because if you give pain medication, if the pain is tolerable, no, there are these pain medications sometimes are, they are addicting, no. Even if the patient is not in pain, would ask, it's in pain. Sometimes what we do, we give them placebo. If they are really with placebo, these patients are really making fun of us, right? So we really have to do assessment very thoroughly. So that's how we intervene with pain here in the Philippines. Is it the same also with you, sir, or immediately you give pain medications? So it's also the same.
Yes, the same.
Those are actually one of the very important roles of the nurse. No, we really have to assess. We really have to be very good in assessment. Sometimes they are lying. They say it's very painful, but they are still laughing. So probably
Yes,
you're joking. Because the statement is not congruent with the facial reaction. It's very painful, no? So
yes.
you cannot smile anymore if it's the pain is not tolerable, right? So
All right.
we really, nurses are very good when it comes to assessment.
Okay, thank you, ma'am. To all audience, if you have a question, please, you can ask directly.
Yes, you can ask me anything. Like I said, I will just be sharing my video with you later because it's a very good video. I'm sorry because I'm 30 years behind when it comes to technology. I do not even know how to share my video here in Zoom. No, because what we make use of here in the Philippines when we do virtual classes would be the MS Teams. No, so I know how to share the video in MS Teams. I know how to put on the audio, but in Zoom, I'm sorry.
Ma'am, if there is no question from the audience, I have one question, ma'am.
Okay, sir.
Yes. What is the requirement to become an operative room nurses, ma'am? Is
Here
it
in the
only,
Philippines?
yes, in the Philippines? Indonesia
No.
only by training, ma'am?
Yes, actually, probably there in Indonesia, you really go for training.
Yes.
No, here in the Philippines, no. Usually, when the nurses are hired in the hospital, actually it's part of their. When they fill up the data, you ask them what would be the area with. What would be your favorite area in the hospital where you would like to have your duty? They ask them there. So if they're right there, they want the OR, the ICU, the special areas, no, like dialysis and everything, no. They have first to be in the ward for 6 months. They have first to handle. They have first to handle patients in the ward for 6 months before they are brought to the special area where they want to have their duty.
Is there any certain education for the specialist nurses, as you said, ma'am? For example,
no, for OR in general,
yes.
none. But
Yes.
I think in special procedures, like for example, the opta surgeries, no, these are actually special nurses. Sometimes they send the nurses for training, or they do observation during the laparoscopic. There's no special training for all of those. No, all they have to do is they just observe, and then they assist, and then while assisting, the surgeon would assist them, instruct them on what to do, and then there, practice makes perfect, and then every day, every exposure, it makes them a better. It makes them better on how to assist the surgery, actually. So that's how it is. No? But in other special areas, like for example, the dialysis, no, I think the nurses go for training for 3 to 6 months before they can. So it's just the same also there.
The same.
Okay. Yes,
Okay.
it's the same.
We still have 10 minutes, ma'am.
Yes.
If there is a question from the audience, please, you can ask directly to the Ma'am Sheila.
Yeah. I told myself that if I'm going to have this lecture, it would be better if I don't go beyond the time. Because like I said, no, Sir Kiza will be angry at me if I go beyond the time.
Yes. Okay. I think
that time is
time
is really very important with you. I
Yes.
know, because
Okay,
when we were there, when you say it's 8 a.m., everybody is already there before 8 a.m. Not like the Philippine time. If it's 8 a.m., 8:30, and 9 a.m., that's the Philippine time. They are always late.
Almost similar, ma'am. Okay, because there is no question anymore, I think this session will end. That's our lecture today with Ma'am Sheila from SPUP. Our deepest appreciation for her sharing and insightful knowledge, particularly in perioperative nursing. See you again, Ma'am, on other occasions and activities with us. Our best regard for all faculty members in SPUP.
We also, sir, if you have some lectures also like this,
Yes,
you can also invite us to attend to your lectures, because I think we will also be very willing to attend your lectures, so that we can compare your practices with ours, not only in the perioperative, but in all the other areas in the hospital. You can also invite us to join you in your lectures, so that we would also know of your practice. Yes.
We are considering about that.
Yes. Thank you very
once
much.
again. Yes. Thank you. And for the students, I think this is the end of this session. And once again, thank you for your participation and your questions in this session. Yes, I think enough. For Mbak Serving, I'll return it to you. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you to Mr. Arif Bahtiar as Kepmas and PhD as moderator. Before the International Guest Lecture 2021 ends, permission to inform all International Guest Lecture 2021 participants and invited guests to activate the camera, because there was a group photo session. For those who have not turned on the camera, please turn on the camera. The photo session will start on the count of 3.
I will screenshot on the count of 3. So slide 1, 1, 2, 3. Slide 2, 1, 2, 3. Slide 3. 1, 2, 3. Slide 4. 1, 2, 3. Slide 5. 1, 2, 3. Done. Thank you.
And we come to the end of the event. Before we end the event, let's say Hamdalah together. Alhamdulillahirabbil alamin for completing this event with wisdom and smoothly. Alright, that's the series of International Guest Lecture 2021. I am Sarfin Anggraini as the host and this present all colleagues on duty. Say goodbye and apologies if there are mistakes. That's all. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.